Well, hello everybody. First off, I want to say I'm sorry. I've been AWOL for like 3 months. um, and I thought, you know what, I'm going to put aside some time and do a video. So just to give you a little update and talk about recent symptom that I've been having. And I also got my bone marrow biopsy results. So I know I talked a little bit in my last video about what those results were, and I did have my follow-up in June, I think it was, and that's when I asked her if I could have a copy of it, because we talked about the results in March, but we didn't go into much detail about them. So I thought I'm going to get a copy of the report and then I'm going to share it with you. So basically, the report is broken down kind of into sections where they talk about the quality of the sample, if it's suboptimal or optimal. And then they talk about the aspirate biopsy, and they also talk about the biopsy of the solid piece of bone that they take. So mine came back. Oh, and then they also do like I guess analysis or count of your blood cells, peripheral blood, that's done at the same time as the bone marrow biopsy. So first part right off the top just has like where you had it done, the date, your doctor, all that stuff. And then the diagnosis is right at the front. So PV, but it also says bone marrow aspirate clot section and biopsy, bone marrow showing trilineage hematopoiesis. So that's normal. So tri meaning 3, and then lineage, I guess, is the 3 cell lines, red, white, and platelets. And hematopoiesis, I believe, is the development of cells, blood cells from your stem cells. And then it says, please see microscopic description. So specimen, then it just kind of says what the specimen is. So there's the aspirate, the core, and bone marrow slides for iron. And then it says clinical history. So what your clinical history is. So mine's, 49-year-old female, JAK2 positive, PV or evidence of fibrosis, polycythemia, ? And then it has my CBC. So my SED rate was low, so no inflammation. And if you've watched my previous videos, one thing that I actually complained about more leading up to this diagnosis was pain in my legs, hips, and feet. So it's surprising to me that there's no inflammation, it's really strange, because I'm still waiting on a referral to a rheumatologist to investigate those pains a bit more. Reticulin count was 1.4. Normal is 0 to 2%. So I'm in the normal range. White blood cell count high. No surprise. It's always high. It's 11.87. And the range is 4 to 11. So it's not like really high. I'd say it's elevated, if anything. My RBC count was 4.87, and the normal range for this lab is 4 to 5.50. So within range. And then my hemoglobin at that time was 152, and the range is 115 to 160, so my hemoglobin was within range. Hematocrit was 0.461. The range is 0.35 to 0.470. So it's within range, but right at the top end of the range, just slightly under. And for those of us with PV, we all know that I think most times the target is 45.45 or less. And in some studies, clinical research, some would argue that for women, the target level should be 0.42. So mine's a little over 45 at that time. And then my platelets were 250. Normal is 150 to 400. So they're within range. So let's get to the good stuff. So the peripheral blood smear showed normocytic, normal chromatic red blood cells. Leukocytosis, so that just means an abundance of white cells, overproduction of white cells. Absolute neutrophilia. So for your white blood cell count, there's a whole bunch of different white blood cells, right? There's your neutrophils, your lymphocytes, eosinophils, basophils. And my high white blood cell count can always be attributed to neutrophils. Sometimes lymphocytes are up there, but it's mainly the neutrophils. And then it says mild left shift. So from all the reading and research that I've done, when they talk about a shift, and again, I'm no doctor. I'm not a nurse. I'm not in the medical field. This is just stuff that I've read off the various medical sites and, research and studies, is a left shift tends to indicate a slight predominance of immature cells, but no blasts were seen. And that's a good thing. You don't want immature stem cells or blood cells being released into your peripheral blood. Normal platelet count. And then the bone marrow, I'm out of breath a little bit, sorry. Whew, I don't know why. The bone marrow aspirate clot section and biopsy. It says the bone marrow aspirate and clot section are adequate. So I guess that's in reference to the sample. They show trilineage hematopoiesis. Erythropoiesis is mildly left shifted. So again, a slight predominance in the immature red blood cells. Granulopoiesis appears maturing. Blasts are not increased. Megakaryocytes are unremarkable. Lymphocytes and plasma cells are unremarkable. So that's good. Bone marrow iron is markedly reduced to absent. Again, if you've listened to my videos, you know that my iron's always low. The myeloid erythroid ratio is 6:1. So I believe normal is 3:1. So the 6:1 is indicative of, again, the high white blood cell count. It says the bone marrow biopsy is suboptimal. It shows trilineage hematopoiesis. And then it talks about the stain. So when they take your sample and they put the sample on the slides, they do the smears. And then I guess when they do the pathology, they put various stains on it. And certain stains will indicate certain things, I guess, if they're positive. So it says immunohistochemical stains performed on the bone marrow clot sections show CD3, CD5, and CD20 stains scattered T and B lymphocytes. CD138 stains scattered plasma cells, and CD34 stains less than 1% of the cells. Reticulin and trichrome stains do not show increased marrow fibrosis. So that's good. The clinical history of a myeloproliferative disorder is noted. Clinical correlation and follow-up, including cytogenetics is suggested. Flow cytometry report signed by Dr. blah, blah, blah. No flow cytometric evidence of clonal B or T cell populations. So that would seem to suggest or rule out any lymphoma. No increase in plasma cells, monocytes, or blasts. So that's good. So again, pretty much in line with what she had told me that she wasn't really concerned. The iron, again, she's not willing to treat that because obviously when you have PV, you don't want to increase your red blood cells. So that was the bone marrow biopsy. In other news, I think I mentioned during my last video that I had not really experienced what I consider, well, itching. I never had the itching, right? Lo and behold, just probably in the last week and a half, I started coming up with hives. And I don't know if you can, I got one there. And I think I got one over here. I got a few under here. You can't, there's one right there. But mainly on my, I'm just going to show you my arm. Let me find one. There's one on my elbow. There's one, you can see it kind of right in there. Let me see if I can find some more. I think I got a couple back here, under there. Sorry for my armpit. And then I have, oh yeah, see that one? That's the one I was just scratching. There's two of them there. And you can kind of see they're raised. They're like hives, kind of. And I think I have one. Yeah, I have one back here, right there on my arm. And I have, I think, a couple, one on my leg and then my feet. This one's really itchy, this one down here on my elbow. So pardon the scratching. Yeah, I really hadn't had itching, and now, oh my God, these things are like, they are so itchy. At first I thought maybe I'm having an allergic reaction, and I was talking to my husband. I'm like, I haven't eaten anything different. I haven't used any new detergent or soaps, perfumes, nothing. So it didn't dawn on me that it might be the PV, because I thought with PV, it's predominantly you get like the itching after you have like a hot shower. This is nothing, like they just come up. I find when I do shower, after I get out of the shower, they're really itchy. But they're all the time. So I've tried Benadryl, and I've tried cortisone cream, and they're not helping at all. So I think my next follow-up with the hematologist is in September 12th, because I'm on a 3-month schedule now for follow-ups. I am going to mention it to her, just because if this keeps up, I can't tolerate it. Like, I need something, because I'm up half the night scratching. I'm scratching all day, and they're not the most pleasant to look at. So I know you can't really see them really well in the video, but this one probably, like, that gives you a good idea. Like, they're just, see, there's two there right side by side, and then there's one just a little bit lower. But they're, oh my God, they're like, it's, if you've ever had like a really bad bug bite and it gets irritated, or you rub it and it just starts itching and itching, oh my God, that's what it's like. It's, you just want to rip your skin off. And I've, like, having them around your face, like, my breathing is not compromised at all. I can breathe fine. I'm a little short of breath. Like, I noticed I was huffing and puffing there a little bit. But I can still breathe okay. So yeah, that was kind of weird. Now my other arm is itchy. Sorry, I'm shaking the camera. I'm trying not to shake the camera. So yeah, that's what's new. Other than that, I haven't really had much to speak of. The heat this summer, I can't tolerate the heat. And I'm not a sun worshiper, but I like being outside in the summer, because Canadian winters, like, you're cooped up all the time. I like to get out and garden and stuff like that. I just can't tolerate the heat. It just knocks me out, which sucks. but what are you going to do, right? So, other than that, things are pretty good. Symptoms, like I said, this is kind of my latest issue that I'm having. I kind of went back, and by the way, I keep a journal. I keep all my my PV related stuff in a binder. I didn't even know it was PV related, but I kind of keep all my history and my labs, and I keep a running tally of my occurrences or medical issues, right? So if I break out like this, I'll just jot it down. You know, August, broke out in hives. So I went back and I was looking at it because I've started doing this probably, I don't know, about 2 years ago, 3 years ago. I started kind of tracking all these because I would get these weird one-off crazy things. Like I remember one, it was 2 summers. I think it was like 2017, 2016. In the summertime, my feet just swelled up like pregnancy feet. And then they went away. Like they didn't hurt. They just were swollen. And I thought, okay, maybe I'm retaining water. And I never really pursued it because it's just swollen feet. They didn't hurt. Like I have muscle pain and foot pain, but not from the swelling. Like the swelling didn't hurt. So it was strange. And then I remember one time I woke up and my eye was swollen. Like, I mean, like swollen. Like the hole up here was just swollen so much that I couldn't really open it. And then it kind of subsided and went away within 24 hours. See, now I'm itching under here. Oh. What else? Oh, I never mentioned this to you guys. And I don't know if you can see it really good, but I'm going to show you my hand. I have red dots. They're like little flecks. I think you can see them there on the palm a bit. And then I have a couple on my fingers. They don't really show up. Oh yeah, now you can see it kind of. I showed those. I've had those for years. This hand's not as noticeable. There's like a couple on my fingers. I don't know if you can see them. Not really. But things like that, like really weird. Like the dots on my hand, they don't hurt. And they're under the skin. They're not angiomas. Like I have like a couple of angiomas. They're more like little red moles. These things are just like little red flecks under the skin. So I had showed those to the hematologist too, and I'm like, is this part of this? Like, I've had these for years. And my doctor didn't really know what they were. The first thing they asked me was, do you have them on your feet? Because I guess they thought it was like petechiae? I don't know if I'm saying that right. Which can be, I think, a sign of leukemia. But they don't think that that's what it is. They think it's, and bear with me, telangiectasia, which is broken blood vessels. That may be more consistent with PV, I think. Or maybe it's rheumatological, because there's other, I know one disorder, scleroderma, that kind of like flecks, those like little red flecks, it's common with scleroderma. Who knows? It's anyone's guess, right? I'm trying to think what else weird. Oh, I remember one time I developed like in my throat, I developed like I don't want to say it was a sore throat, but it was almost like I had an obstruction in my throat. Like when I swallowed, it felt like there was something stuck in my throat. Kind of like, when you swallow a pill and it doesn't go down, or a piece of food and it kind of sits there in your throat. It didn't hurt. It was like a discomfort. Like you could feel like an obstruction there. That lasted probably a few weeks, and then that went away. Again, I never pursued it because it went away. So yeah, like all these weird little one-off things. But yeah, so this is my binder where I keep everything. All the articles and stuff that I've read. There's some really good sites out there. I don't have them off the top of my head. Maybe I'll try and post them down below when I post the video. But anyway, that's kind of it in a nutshell. My next follow-up is in September, like I said. So again, I'll probably mention this to her, and hopefully maybe this is going to be one of those things that kind of just resolves itself. Who knows? We will find out. And phlebotomies, I still haven't had, I haven't had to have a phlebotomy. I think my last blood work was in June. And my hematocrit was 43 point something. I think it was close to 44, but again, it was under 45. So my next one now is the end of August, because I go every 2 months. And I just have like a standing, I don't go to the hospital lab anymore. I just go to the regular blood labs. They're called life labs here in Ontario. So I go there, and I actually just have a card, so I don't have to go get a requisition. I just have a card, and it has my orders on it for what the tests are that she wants. And then I just go there and get it done, and then I can check my results online, which is good, because I like to track that stuff. And that's about it. So anyway, hope everyone is keeping well. Shout out to everyone on the PV Facebook group. You guys are great. I posted a picture of my hives on there just to see if anyone else, if they have the same kind of thing when they break out, like, or when they get itchy. Anyway, I'm rambling, so I'm going to sign off for now, and I will probably do another video, hopefully after my next follow-up in September, and keep you posted if I get anything prescribed for this itching. So take care, everyone. Hope all is well. Bye.